Let's review the top causes of death during the year 2023. Now, I've been anxiously waiting for the CDC to put out this report, and I've been disappointed. Every single April, the CDC has put out and enumerated the leading causes of death and how many people have died from different conditions. And I will share with you thumbnails to those videos. Many of you have viewed those videos, but for some reason, the CDC hasn't put out this report. But I did come across this article in the Journal of Internal Medicine that has looked at the provisional statistics for the leading causes of death, and we're going to review this report right here. And this is drawing upon data from the CDC, the National Health and Vital Statistics. The title of this paper is, Has Mortality in the U.S. Returned to Pre-Pandemic Levels? An Analysis of Provisional 2023 Data. Again, I think this is really important because when people know what is most likely statistically to cause them to die prematurely, I hope, at least, that's my aim, is to encourage healthy nutrition and lifestyle changes. Now, as you might remember from those 3 prior videos, again, we did this in 2020, 2021, as well as 2022. It was heart disease, cancer, and COVID. Okay. Now, COVID kind of bounced around. I think in 2020 and 2021, it was the second leading cause. Of course, as you know, if you've been following my channel or other channels, those statistics can be a little bit wonky because some people had other underlying health conditions prior to getting COVID and had comorbidities. But that being said, those deaths were characterized as a result of COVID-19. Now, in 2022, these statistics in terms of leading causes of death, it was about 600,000 deaths from heart disease. Cancer was about 590,000, and I think COVID was 390,000 some odd deaths. But the statistics are actually quite similar for 2023, excluding a few novel findings, which I think is really important. And we're going to focus on stroke as well as deaths in children during the year 2022. There was a spike in deaths in children, curiously, in the Northern Hemisphere as well as here in the US. So as you can see here from figure 2, diseases of the heart still claim the most lives here in the US. And the numbers peaked in 2021, 2022, and they're down a little bit just below pre-pandemic levels in 2023. Now, we've heard a lot about the rise in early onset cancer, and so it's not surprising that cancer and deaths from neoplastic conditions, cancers, that's how they're characterized in the literature often, sit at number 2 in terms of leading causes of mortality. The age-adjusted mortality rate per 100,000 people from heart disease is around 160 people per 100,000 annually. Cancer is just behind that at about 142,000. Well, then it drops to COVID. Now, it's interesting. I was just at the grocery store the other day, and there's still a lot of people masking, and I think they're trying to avoid a cold or flu or what have you. But the probability of dying from these Omicron-related variants from COVID are really, really low. The age-adjusted mortality rate is less than 5. In contrast, back in 2021, this was closer to 100 per 100,000 people. Then we look at accidents, we look at strokes, we look at Alzheimer's, diabetes. The list goes on. We're going to really dive into those momentarily. But first, why this paper? There's a few other papers that we're going to talk about and weave this into this narrative, but I think it's important so that people know where to direct their attention when it comes to prevention measures, sleep, metabolic health, exercise, stress reduction, and so forth. The investigators write, all-cause mortality for all races and ethnic cohorts peaked in 2020 or 2021 and subsequently downtrended in 2022 and 2023, although it remained above pre-pandemic levels for certain conditions. Likewise, mortality for most age groups peaked in 2021, except for those between the ages of 1 and 4 and 5 and 14 years, who had a mortality peak in 2022. Now, there's something that was curious towards the end of 2021. I'll let you use your imagination to see or think about what happened, what was rolled out at the end of 2021. Okay, so there's 2 tables that I want to share with you. The first one here is the leading causes of death according to ICD-10 diagnostic codes. As you can see here, diseases of the heart sit at number 1. We just shared with you the age-adjusted mortality rate there. The second leading cause of death was malignant neoplasms, followed by accidents, chronic lower respiratory diseases, cerebrovascular diseases like stroke, Alzheimer's, diabetes mellitus, chronic kidney disease sits at number 9, intentional self-harm or suicide sits at number 10, and the list goes on. Parkinson's was 14, and essential hypertension and renal hypertension was 13. So here is the table. Now, what's curious here, I'm not insinuating any conspiracy theories. I think this is quite interesting. If you look at strokes and cerebrovascular diseases, that is the only thing that is still high compared to pre-pandemic levels. If you look at diseases of the heart, the age-adjusted mortality rate is still lower now in 2023 compared to pre-pandemic levels, as well as cancers. That has, it's a little bit lower. Accidents are about the same. Chronic lower respiratory diseases are lower, but strokes are actually higher. Now, that could be from a bunch of different things. Exercise, we're going to talk about spending time in nature. There's actually some really good evidence to suggest that contact with the environment is inversely correlated with severity of COVID as well as other aspects of health. And I think that's really important. But first, friends, I just want to say thank you for being here. I really, really appreciate your views, your comments, your shares. If you're enjoying this content, please hit that like button and share this with a friend who may benefit. Also, because we're talking about metabolic health and lifestyle choices, I just want to let you know that a natural tool that has a 3,000-year safety record called berberine hydrochloride is a great tool to help kickstart your fast and help with evening food cravings and support metabolic health. When I first started taking berberine back in 2015, I noticed that it increased ketones and it helped me suppress appetite and not crave ice cream and cookies and some of the discretionary foods in the evening time. I know it's summer, there's barbecues, there's events, there's festivals and things like that where it's, you're a little bit more susceptible to overeating some junk. If you are one of those people and you want to stay lean and metabolically healthy, give the Berberine Fasting Accelerator by Myoscience a try. You can take 2 to 3 capsules before your last meal and notice that your cravings for food and your metabolic health is being supported. There's hundreds of reviews from people just like you who have benefited from this formula. I encourage you to check out those reviews. And if you want to consider purchasing it, you can use the code podcast at checkout. I will put links in the description below. Okay, so time in nature, how does that tie into all this stuff? Well, we hear about grounding and vitamin D and all of this, but there was this article that was published in one of the Nature journals, which is a high impact journal. The subjournal is Scientific Reports. The title of this paper is Contacts with Environmental Biodiversity Affect Human Health. Links revealed during the initial waves of the COVID-19 pandemic. And what was really interesting is people generally report better self-reported subjective health when they spend more time in nature. Now, I think this is really important when we look at the spike in deaths in 2020 and 2021 and 22. A lot of people were not going and spending time outside because parks and things were closed. Well, it turns out that getting out in nature, we now have good evidence. It's called Shinrin-Roku. This has been studied in Japan and all throughout the world that spending time in nature improves your health, probably because of vitamin D exposure, but also just being exposed to the elements in nature, the biodiversity of the microbes in the soil and the elements outside actually improved health and physical health. And I think this is really important because we were talking about all-cause mortality and deaths. There is a negative association with the severity of SARS-CoV-2 infection with physical health, as well as spending time in nature. So this is really important. I think this dovetailed into why people are concerned about the rising cause of all-cause mortality. There's deaths from all causes are increasing, as we have alluded to. The pre-pandemic levels of all-cause mortality is still up pre-pandemic. So I think we're seeing a reduction in cardiovascular mortality, but an increase in self-harm and suicide and drug overdoses and all these other challenges. And we need to start to look at why people just don't feel good. And part of that is just not spending enough time in nature. That's one aspect of it. Another aspect of it here is the public health recommendations are insufficient to prevent non-communicable diseases. This was an editorial published in the British Medical Journal titled, "The COVID Public Health Emergency is Ending. It now joins the ordinary emergency that is American health." And so this editorial talks about how the rise in non-communicable diseases is really burdening the healthcare system and causing an unprecedented rise in preventable deaths. And no one seems to really care about it. We're not really doing much about it. I was just watching the Olympics, and as you know, Coca-Cola is the longest standing sponsor of the Olympics. So how can we be serious about preventing diseases like cardiovascular disease and cancer if we are endorsing the consumption of sugar-sweetened beverages, which unequivocally is linked with the onset of all these non-communicable diseases? And it's just crazy to me that so many people were, and society and the public, the powers that be wanted you to change your lifestyle and be a recluse to avoid COVID. But no one really said anything about preventing these non-communicable diseases, which I might add, I think it's important to know that they claim more lives than COVID did, but no one seems to care because they're not directly transmittable. Now, your friends, your family, your peers, the people you hang out with, if they eat Chick-fil-A and drink soda and smoke cigarettes and drink alcohol and all that, you're more likely to engage in those same behaviors. So they're not directly transmittable, but they are by association. So I think it's important that we know that cardiovascular disease, cancer, as well as strokes, kidney disease, and so forth, these are still claiming a lot of lives. The statistics show that in some of these conditions, like cancer, it's slightly lower than pre-pandemic levels, heart disease slightly lower than pre-pandemic levels, but strokes are up, as well as other causes of mortality. So, the healthcare system is great. Many doctors go into healthcare because they care about people. That's why they're in medicine. But the system is set up to not really address the non-communicable diseases. Many doctors, when they're residents, they focus on acute care, lacerations, burns, trauma, infections. But many people are now seeking out mainstream medicine because they have non-communicable diseases from their poor lifestyle choices. And so the point of this video is to help you understand and recognize that many people acknowledge that lifestyle is the solution, nutrition is the solution, and that's where we should focus our efforts. So there is proof, there's good evidence, even spending time in nature, exercise, all of these things are really, really effective. So I wanted to share these statistics with you so you have a good idea about where to focus your lifestyle changes. Now, in terms of heart disease, because that is the leading cause of mortality, we know that walking 8,000 or 9,000 steps per day is a really effective way to lower blood pressure and improve your cardiovascular health. Getting good sleep, breathing through your nose when you're sleeping, not consuming hyperpalatable, ultra-processed junk food. A lot of people focus on red meat and processed red meat and minimizing red meat consumption in dairy and animal products, but discretionary foods, baked goods, sugar-sweetened beverages, chips, bread, crackers, those are the foods that are linked with atherosclerosis, the formation of the narrowing of the heart, leading to heart disease as well as strokes. So your lifestyle is going to impact how long you are living healthfully on this earth. Please make the appropriate changes. I very much appreciate you watching all the way to the end. If you enjoyed this content, hit that like button. Be sure to subscribe to this channel, and we'll catch you on a future episode down the road.